Hello and welcome. Today I'll be discussing lumbar microdiscectomy surgery, which is a common spine procedure performed to relieve pain caused by a herniated lumbar disc. In this talk, I'll cover the indications for surgery, the potential benefits, the known risks with the data from published studies, and the alternatives to this operation. And this video is intended for people who are thinking about undergoing this operation. First, lumbar microdiscectomy is most commonly indicated for patients who have the following. Patients with persistent radiculopathy, meaning they have leg pain, or they have numbness, or they have weakness, and this is caused by a herniated disc pressing on a spinal nerve. There's been failure of conservative treatment, such as physical therapy, medications, and even epidural steroid injections, typically after about 12 weeks without sufficient improvement. Or there's a neurologic deficit, such as progressive weakness in the foot or in the leg, or in rare urgent cases, bowel bladder dysfunction, which is known as cauda equina syndrome. The goal of surgery is not primarily to treat back pain, but it is to relieve leg symptoms caused by this nerve root compression. When performed in the right patients, lumbar microdiscectomy is associated with the following. Rapid leg pain relief in the majority of patients, often within days to weeks. Improved function and mobility, allowing patients to return to normal activity sooner. High success rates. Studies report that about 80 to 90% of patients experience significant improvement in their leg pain following surgery. The surgery is associated with durable outcomes. Relief can last for years, although recurrence is possible, as I'll discuss later in risks. Like any surgery, lumbar microdiscectomy surgery carries risks. While the overall complication rate is low, it is important to review the specific complications and their reported frequencies. Dural tear with cerebrospinal fluid leak. This occurs in approximately 1 to 7% of cases, and here's a reference for your reading pleasure. Most can be repaired at the time of surgery without long-term problems. Infection. The risk of deep infection is generally less than 1%, and superficial wound infections occur in about 1 to 2% of patients. Nerve injury. Permanent nerve damage is rare, estimated at less than 1%, though temporary numbness, tingling, or even weakness may occur in up to 5 to 10% of cases. Recurrent disc herniation. This is one of the most significant risks. Reherniation at the same level occurs in about 5 to 15% of patients over time, sometimes requiring repeat surgery. Bleeding or hematoma. Symptomatic hematoma is rare, occurring in less than 0.5% of patients, but can require urgent reoperation. General medical risks. As with any procedure requiring anesthesia, risks include blood clots, pulmonary complications, cardiac events, although these are uncommon in otherwise healthy individuals. To summarize, the overall risk of a serious permanent complication is very low, but risks such as recurrent reherniation and dural tear are important to understand. Not every patient with a lumbar disc herniation requires surgery. There are alternatives to surgery. Physical therapy is one. Exercise focused on core stabilization, flexibility, and posture are important. Medications can help, such as nonsteroidal anti-inflammatories. Acetaminophen or even neuropathic pain medications can help. Epidural steroid injections. These may provide temporary pain relief for a nerve that's being irritated. Activity modification and time. As many herniated discs will shrink or they'll actually heal naturally over a period of weeks to months. The body does have the ability to resorb that disc material. It's important to remember that studies such as the SPORT trial have shown that many patients improve without surgery, believe it or not. Surgery is generally offered when symptoms are severe, persistent, or worsening despite conservative measures. In summary, lumbar microdiscectomy is a well-established procedure designed to relieve leg pain caused by a herniated lumbar disc. Indications include persistent leg symptoms, neurologic deficits, or failure of conservative care. Benefits are rapid and significant pain relief in 80 to 90% of patients, along with improved function. Risks include dural tear, infection, recurrent herniation, and rare permanent nerve injury. Alternatives include physical therapy, medications, and injections, which may be effective for many patients. Ultimately, the decision to proceed with surgery should be made after careful discussion between the patient and the spine surgeon, weighing the severity of symptoms, the risks of surgery, and the likelihood of improvement with or without an operation. Thank you for watching this educational overview of lumbar microdiscectomy surgery. I hope this helps you better understand the indications, the risks, benefits, and the alternatives so that you can make an informed decision in consultation with your healthcare provider.